from INTENSIVECAREHOTLINE.com. Hi everyone, it's Patrik here from INTENSIVECAREHOTLINE.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, get peace of mind, control, power and influence if you have a family member in intensive care. So I'm just quickly announcing here that I will be doing live sessions going forward as early as of today. And you can do two things. You can either type your question in the chat pad, or you can also call me on the numbers on our website, and I'll just quickly type them in the chat pad. If you are in the US or in Canada, you can call me on 415-915-0090, and we can actually answer your questions live here. Or you can type them in the chat pad, and I'll also type in my number if you are in the UK, 0118-324-3018. That's in the UK or Ireland. And if you are in Australia, you can call me on 041-094-2230. So I'll just type those numbers in the chat pad. So, or alternatively, just type your questions in the chat pad. So, but let me just start again to why am I doing this? It's as simple as I know there's thousands of families in intensive care all over the world every day struggling with having a loved one in intensive care. And their biggest challenge is simply that they don't know what they don't know. It's a massive challenge, and most families in intensive care completely underestimate having their loved one in intensive care. They don't know what to expect. They don't know what to look for. They don't know what questions to ask. And worst of all, they don't know how to manage the doctors and the nurses in intensive care to get outcomes. It's like walking into a horror movie and not knowing what to expect. Just to give you a little bit of background, I have worked in intensive care for over 20 years. I have worked as an intensive care nurse for over 20 years. Out of those 20 years, I worked for over 5 years as a nurse unit manager in intensive care. So, you know, besides looking after thousands of critically ill patients and their families, I've also gotten to see the ins and outs of how intensive care units are run. I've seen what intensive care units are aiming for. I know their agenda. I know the pressure that intensive care units are under when it comes to bed management, to financial management, to staff management, to the politics and how that impacts on patient care. And if you are unaware of those dynamics, you could be in for an even wilder ride, because intensive care units have agendas that go way beyond your loved one's prognosis and diagnosis. So therefore, I can't emphasize enough how important it is for you to understand more about intensive care, because it's such a niche area, and it takes years of training, takes many years of training to understand intensive care, to operate in the environment without getting burned out. So imagine you're walking into intensive care with a family member potentially hanging on to life by a thread, and you don't know enough about intensive care. It's literally life or death. It's that important. So let me just focus on the main pain points and some of the solutions for families in intensive care. So when families come to us, they generally speaking come to us because of 4 main pain points and frustrations. The number one pain point they're coming to us with is end of life. So a lot of families come to us and they ring us up, or they send us an email and they say, look, my loved one has been in intensive care for a week. They might have had a head injury. They might have had a pneumonia. They might have had sepsis. There's so many different diagnoses why people go into intensive care. And then they come to us and they say, look, the intensive care team has told them that tomorrow at 1 o'clock they need to stop life support. Right? What does that mean? Well, at the end of the day, it means that your loved one is going to die tomorrow at 3 o'clock or whatever the case may be. That's how unprepared families are. They don't see it coming. They do not see that coming. They act completely surprised because they're so inexperienced in this area. And again, now after having worked in intensive care for over 20 years, I know that it's coming, right? And families are completely taken aback that within 24 hours their loved one is supposed to die, and they are thinking that intensive care units would move heaven and earth to save their loved one's lives, and they're completely surprised when it's not happening. So where does that lead to? Well, it leads to advocacy for families and for patients. You as a family or the patient has actually a lot of rights. The intensive care team can't just withdraw life support tomorrow at 3 o'clock because they feel like it. They're not operating in a vacuum. That's almost like dragging somebody to an execution, right? You need to be highly aware of your rights and of your loved one's rights. And we can help you with that. We've saved many lives. And whilst I would not claim that we can save a life, but we can definitely buy you time with our clinical reasoning and with our clinical consulting and advocacy. That's one way how we help you. Clinical reasoning and clinical advocacy. And another way we help is simply by knowing and understanding patients and families' rights in intensive care. Right? That's how we help you in what I refer to as a perceived end-of-life situation. If you get told that tomorrow at 1 o'clock the intensive care team wants to withdraw or stop life support for your loved one, your loved one is most likely in a perceived and not in a real end-of-life situation. Knowing the difference is the difference between life or death. It's as simple as that. Right. So then the next pain point or frustration that families in intensive care come to us is, how long can a breathing tube stay in? So a lot of patients in intensive care are ventilated. They have a breathing tube in their mouth. And that breathing tube, generally speaking, can only stay in for up to 2 weeks. And then the next step is either to remove the breathing tube and successfully remove the breathing tube, I should say that. Or number two, do a tracheostomy and move towards more long-term ventilation. Okay. If your loved one is in the situation where they have a breathing tube and they're coming to the 10 to 14 day mark, and the intensive care team is telling you they can't take out the breathing tube and they need a tracheostomy, you again need to contact me. You need to call me on one of the numbers that I just typed into the chat pad, or you need to send me an email to support@intensivecarehotline.com with your situation. The reality is that before a tracheostomy can be done, the intensive care team needs to do everything beyond the shadow of a doubt to enable your loved one to breathe without the breathing tube. And again, I have written articles and made videos about that, how that can be done and how that can be achieved. If your loved one or if the intensive care team hasn't done that, a tracheostomy simply shouldn't be on the cards. But how do you verify that the intensive care team has done everything beyond the shadow of a doubt that the breathing tube can come out? Again, that's where our expertise comes in. You can read up some articles, or you can simply call me or send me an email, and then I will take the next steps with you by basically talking to the intensive care team. Have they done everything? Have they ticked all the boxes so that your loved one can have the breathing tube removed. And on that topic as well, if your loved one goes towards a tracheostomy, if you are in the United States, most of those patients in intensive care in the United States, if they have a tracheostomy, end up going to LTAC or long-term acute care. And again, your loved one should not go to LTAC or long-term acute care. Again, I have written about this extensively. We have hundreds of case studies on our website where you can see when people approach us when their loved one is in LTAC or long-term acute care, it's a disaster. LTACs cannot look after ventilated patients with tracheostomies. Just not happening. They don't have the skills and the expertise. So therefore, if you are in the United States, if your loved one ends up moving towards a tracheostomy and is scheduled to go to LTAC, you need to stop that. I'm not saying your loved one shouldn't have a tracheostomy. A tracheostomy has their time and their place. I'm not opposed to it by any means. Tracheostomies have their time and their place. But the next step after tracheostomy is crucial. You do not want your loved one to go to LTAC. And again, we have helped many families in intensive care to avoid LTAC and keep them in intensive care, because intensive care is the right place for somebody to be weaned off the ventilator and the tracheostomy, because it takes the skills of intensive care doctors, of intensive care nurses to wean somebody off the ventilator and the tracheostomy. So the next frustration and pain point where people come to us is they ask, how long does it take for my loved one to wake up after an induced coma? So when patients go into intensive care and they end up with a breathing tube and on a ventilator, they need to be induced into a coma. Why is that? Mechanical ventilation and the breathing tube are very uncomfortable. You got to keep in mind your loved one has a breathing tube down their throat, and that is very painful, right? They need the breathing tube because otherwise they couldn't sustain life. Their critical illness has put them in a situation where they need the level of life support of a ventilator, and then they need the induced coma. Now, and then when patients come out of the induced coma, it can take sometimes days, potentially even weeks to wake up. And in some instances, patients may not wake up, or if they do wake up, they may be confused. They may have brain damage. There could be all sorts of things happening after an induced coma. And again, it takes the insights of 20 years ICU experience, where I can help you with, to guide you through this process when your loved one is coming out of an induced coma, because I've seen it thousands of times. What is important when your loved one is coming out of an induced coma? Does it mean if your loved one is squeezing fingers, they are halfway there of waking up? Does it mean if your loved one is blinking the eyes, that they can hear you, that they are waking up? And again, the answer to the question, how long does it take to wake up after an induced coma, is simply, it depends. It depends. It depends on what medication has your loved one been on while they were in the induced coma, right? It depends how long they were on the medication. It depends, are they potentially in acute renal failure, in liver failure, because then it takes longer to metabolize or excrete the medications, right? So it depends on so many nuances, that I can't stress this enough. You will need the insight of somebody who has worked in the environment for decades to break this all down for you, and so that you understand the bigger picture. Last but not least, the fourth pain point where people come to us is head and brain injuries. So, if your loved one, God forbid, has been in a car accident, in a motorbike accident, road bike accident, and sustained a head injury, or potentially had a cardiac arrest or a stroke, and has some hypoxic brain damage because of the stroke or the cardiac arrest, I can tell you from experience, it can take weeks or months to wake up, right? Even though the CT scan or the MRI scan of the brain on admission to hospital after the event paints a very negative picture, right? from experience, it takes weeks, months, sometimes even years to see improvement. And again, in those situations, if your loved one has sustained a traumatic head or brain injury, or an anoxic or a hypoxic brain injury, the intensive care team is very quick in painting the doom and gloom picture, and it's very quick in wanting to withdraw treatment or life support. Okay, so you need to have strategies around that. If you don't have strategies around that, your loved one can be dead within 24, 48 hours, and you don't even know what's happening, right? Having strategies if your loved one goes into intensive care is critical. It's the difference between life or death often. So head and brain injuries, as I said, it's probably the scenario where the intensive care team is painting the worst, quote unquote, doom and gloom picture, and is very negative, because it also presents the intensive care team's worst case scenario. What's their worst case scenario? Their worst case scenario is to look after a patient indefinitely with an uncertain outcome, and nothing could be worse for them than head and brain injuries, because that's exactly the case in head and brain injuries, that it's often looking after a patient with a head or brain injury with an uncertain outcome indefinitely, or for an indefinite period. And that's the intensive care team's worst case scenario. Why is it their worst case scenario? ICU beds are in high demand, right? Having somebody occupying an ICU bed with an uncertain outcome is the ICU team's worst case scenario. They're losing money. It also takes a big emotional investment and commitment to get a patient out of ICU after a head or brain injury. Often goes hand in hand with long-term ventilation, or at least with a tracheostomy, right? So there are complicating factors that the intensive care team simply doesn't want to deal with, right? And so those are the 4 pain points that we really specialize in at intensivecarehotline.com, that we can help you with very fast, because we've seen it all. We know how intensive care units operate, and we also know the gap in knowledge between where you are and where the intensive care team is, and we can bridge that gap and get you outcomes. You will see the dynamics change. Once you start asking the right questions, you will see the dynamics change in your favor very fast, once the intensive care team knows that you are having somebody on the other side that is a clinician on their level. You will get outcomes very, very fast. Now, and I will over the next few weeks do more live videos about those topics, in particular, end of life, ventilation, how long can a breathing tube stay in, when to do a tracheostomy, how to avoid LTAC, head and brain injuries, of course, how long does it take to wake up after induced coma. So I will do more in-depth videos for each single topic. And we also have resources on our website for those specific topics. Last but not least, almost as a bonus, just want to briefly mention, if your loved one is in ICU or in long-term acute care, or potentially sometimes rehabilitation facilities, on ventilation with tracheostomy, and they can't come off the ventilator, we have another solution for that. Go and check out intensivecareathome.com, because we are also providing a service for long-term ventilated patients at home, for long-term ventilated patients with tracheostomies at home, as a genuine alternative to a long-term stay in intensive care. And it'll help you to get your loved one out of intensive care. Okay, so I'll leave it for here today. Check out intensivecarehotline.com. Give me a call on one of the numbers that I just left in the chat pad to answer your questions. And I'll be back live on this channel in the next couple of weeks, providing more knowledge for you. And I'll see you then. Also check out our membership, intensivecaresupport.org, for families of critically ill patients in intensive care. So check out intensivecaresupport.org, where we have a membership for families in intensive care and where you can ask me questions online as well. Take care for now, and I'll talk to you in a few days.